Welcome to OrthoKids. Today, we're going to talk about supracondylar humerus fractures, the most common elbow fracture in children. By the way, did you know that a fracture is the same thing as a break? First, let's look at the structure of the elbow. It's formed by the lower end of the upper arm bone, the humerus, and the upper ends of the two forearm bones, the radius and the ulna. The elbow joint both hinges so you can bend and straighten your arm, and swivels so you can turn your palm up or down. Supracondylar humerus fractures occur just above the widest part of the ends of the humerus. The wide area is called the condyles, so supracondylar means above the condyles, which is right where you'll find the fracture. They usually happen when a child falls on an outstretched arm, but can happen if a child falls on the point of a bent elbow. Falls from monkey bars and trampolines are very common ways for this to happen. Although your doctor may have a strong suspicion that your child has a supracondylar humerus fracture based on the description of the accident and the appearance of the arm, often with a bend or bruising as seen in this picture, X-rays will confirm the diagnosis. The minimum number of X-rays is 2, a front view and a side view of the elbow. Sometimes we get a third partially turned view for more detail, and very often we get X-rays of the wrist too, because wrist and elbow fractures can happen together. Based on the appearance of the X-rays, we classify the fractures into 3 types. In a type 1 fracture, the crack is visible. You can see it if you look carefully in the ovals in the pictures. But the 2 fragments remain in perfect position to one another on both front and side views. In type 2 fractures, the alignment is good on the front view, but the lower fragment is tipped backwards on the side view. In type 3 fractures, the lower fragment has shifted on both front and side views. The classification is important because it guides us in how to treat the fracture. Type 1 fractures can be treated simply in a cast that extends above the elbow for 3 to 4 weeks. Some type 2 fractures can be treated by gently repositioning the fracture fragments and holding them with a cast. This may require sedation. However, types 2 and 3 fractures generally need a surgery. With the child asleep with anesthesia and watching on an X-ray machine to guide us, we can usually push and pull on the arm to align the fragments back to a good position. They won't stay there on their own though, so we insert small, smooth metal pins through the skin to hold the bones in place. The rule of thumb is 2 pins for a type 2 fracture and 3 for a type 3, but that can vary a bit. Most of the time, we insert the pins on the outside of the elbow, away from where the funny bone or ulnar nerve is, but that can vary as well. In rare cases, it is necessary to make an incision to align the bones. A cast or splint is put on in the operating room before the child wakes up. The pins can be removed in the office in 3 to 4 weeks. They slip out in 2 to 3 seconds per pin with a gentle, steady pull. And by then, usually the fracture is healed and no more casting is needed. Children rarely need physical therapy after supracondylar humerus fracture, but your doctor may recommend some stretching exercises at home. Children tend to get their motion back pretty easily in 3 to 6 weeks. They're good to go for most activities at that point, but they may need to wait a bit longer for contact sports and weight bearing on the arms like in gymnastics. There are important nerves and blood vessels in the area of a supracondylar humerus fracture. Your doctor will be checking carefully for any sign of injury to the nerves and blood vessels occurring with the fracture. The most common nerve injury is a stretching or bruising to the nerve that controls bending the tips of the thumb and index finger, so your doctor will check if your child can make an A-OK sign. The nerve will typically recover on its own in 8 to 12 weeks. After the fracture is stabilized, either by a cast or surgery, your child should have minimal to no pain. If they have pain that is not managed by Tylenol or Motrin or is getting worse, please seek immediate care, either with your surgeon or your local emergency department. Children can sometimes have cracks in the bones of the elbow that are so small we can't see them on an X-ray until they've started to heal at about 3 weeks. We call that an occult fracture. Often, we'll have a clue that this is the case because we see some fluid in the back of the joint on the side view X-ray. It's the dark shadow inside the oval on this X-ray. We call that the posterior fat pad sign, and when we see it, there's a 76% chance of an occult fracture. 50% of occult fractures are supracondylar humerus fractures. The rest occur in other areas of the elbow. When we see a posterior fat pad sign, we treat the child in a cast for 3 weeks, which is enough time for the occult fracture to heal. We hope this information has been helpful to you, and thanks for visiting OrthoKids.